but basically talk about repair. So, we talked about this before, and you could bring it up, my favorite, which is the tightrope repair for ACL. So let's say you decide you want biologics, or you're like, hey, I want a biologics and I need my ACL fixed. Well, obviously, in one of our requests was, how do you save proprioception? So the idea behind the repair, we've brought about this about 1 million times now in this podcast, is that if you save the ACL, these patients, I'll tell you, I've done a lot of these. I'm up to like 40 or more. And we just flew down to San Diego to teach about this. So, this is a hot topic. We fix them with this device, and when it goes on to heal, their knee feels better because the proprioceptive things are saved, right? When we do a reconstruction, we're removing all of that, or a lot of it. As much as the doctor tells you to try to save as much, you can't really do a good ACL reconstruction by keeping the entire ACL there. So the idea is you're saving some of the proprioceptive receptors, which is important for certain people, if it heals. And then, there's less stuff that comes out. You're not making a big bone tunnels, and there's less pain. The patients are doing a lot. They're feeling different. That being said, not everybody's a candidate, like I brought up before. Yeah. I would say I do a lot of ACLs, so I'm probably done, if I'm doing probably one every 6 or 7. Now my indications keep getting a little bit broader as I do more of these, and I see, okay, this group is doing really well. Yeah. I'm going to broaden a bit more. This group's doing really well. And I'm going to keep going slowly, so I do this appropriately. Because again, I told patients before, I'm not here to experiment, but I want to give them the cutting edge stuff. So what people don't understand is they always ask, they ask for biologics with this too. They're like, hey, what else can I do? Like ACL repair, that's great. Like that's old news, right? We're on to new stuff. What's the newest thing you can do? Well, what they don't realize, and you can bring up the little pick device, is that every time we do a repair, whether it's a bear, an ACL repair with the tightrope, a combination of both, we'll get into that in a second, we use this device. This is a power pick. There's other ways of doing this too. And basically what we do is we make little holes in the bone where the ACL and the PCL sit. And we actually do this for meniscus tears as well. And this brings bone marrow in. So it's actually covered by insurance, this procedure. So that actually is nice for patients because they're not paying out of pocket for the PRP, which is the platelet-rich plasma, or the bone marrow. And there are people that are looking at whether we can add more biologics. Can we add bone marrow, which you don't always get from just this alone, that's concentrated, or platelet-rich plasma that's concentrated. And it's the same thing they've looked at with meniscus tears. Again, it's hard to show a big difference because this microfracture thing causes improved healing as it is. So it's hard to show something that's as effective as this and biologics being better. Does that make sense?
Yeah, I guess my question is, this tool is creating the holes, right? And
Correct.
then what do you mean that it's promoting bone marrow? When you
so you'll see, and we don't have a video to show you, but when I do this, you see fat bone marrow coming out as you're doing it.
And by creating the hole, now it's going in and then doing its own out. It's coming out.
Coming out.
Okay.
So you're essentially going out into the knee. And what it does actually simulates an ACL tear, because we've seen when you tear your meniscus and then you tear your ACL at the same time and you do the surgery at the same time, they heal way higher rates than if it's just meniscus alone. So you want to simulate this ACL tear. And even if you don't, when you do a reconstruction or you do a repair, you're not making as big of tunnels, you're not doing as much trauma. And so as a result, you want to still simulate this ACL, fluid stuff coming in so people will heal.